If you've been taking metformin for more than a year, let me ask you something your doctor may not have had time to ask. Has anyone checked your B12 levels lately? Not your blood sugar, your B12. Most people taking this medication have never heard that question, and today I want to explain exactly why it matters, along with a few other things about metformin that tend to get mentioned once, quickly, and then never again. My name is Dr. Lawson, and this channel exists for one reason: to give you the kind of clear, honest health information that too often gets left out of a rushed appointment. As always, I'm an AI-assisted educational persona, not a replacement for your own doctor. Everything here is meant to help you ask better questions, not to diagnose or prescribe anything. By the end of this video, you'll understand 3 things about metformin that are common, well-documented, and rarely explained in the 15 minutes most appointments allow. Before we start, tell me in the comments how long you've been taking metformin. I read everyone. Let's start with Frank. Frank is 63, a retired postal worker, the kind of man who walked the same 6-mile route for 22 years and still gets up early out of habit. When his doctor started him on metformin, Frank did exactly what he was told. Same time every morning, with breakfast, never missed a day. About 3 weeks in, Frank started noticing stomach trouble. Nothing severe, just an unsettled, something's off feeling that came and went through the morning. He assumed it would pass. It didn't, not fully, for almost 2 months, and Frank quietly started wondering if the medication just didn't agree with him. Here's what Frank didn't know. Gastrointestinal symptoms in the first several weeks of metformin are extremely common. This isn't usually a sign the medication is wrong for you. It's often just your digestive system adjusting to a new process. Here's what's actually happening. Metformin works mainly by telling your liver to release less stored sugar into your bloodstream, and by helping your body's cells respond better to the insulin you already produce. It's a gentle mechanism, turning down a dial, not adding something foreign and dramatic. That gentle mechanism is exactly why the stomach symptoms happen. Your digestive system has receptors along this same pathway, so when the medication starts working, digestion can genuinely feel different for a while, usually a matter of weeks, not months. Here's the line I want you to remember. Ordinary GI upset, some looseness, mild nausea, and off feeling, especially in the first 4 to 6 weeks, is common, and it often improves on its own, or with a simple change like taking the dose with a larger meal. But there's a different pattern that isn't something to wait out. Unusual muscle pain, difficulty breathing, a rapid heartbeat, or unusual tiredness combined with stomach pain, especially alongside kidney concerns or significant dehydration, is a combination worth a same-day call to your doctor. It's rare, but it's the kind of rare worth knowing about, not the kind worth worrying about daily. Frank's case turned out to be the ordinary kind. Once he mentioned it, instead of quietly pushing through, a simple timing adjustment resolved it within 2 weeks. If you've ever had stomach trouble starting a new medication and just waited it out, drop a comment below. I'd guess a lot of you have a Frank story of your own. If nobody has explained this as clearly as this before, now's a good moment to subscribe, because what I want to walk you through next is the part about metformin that almost never comes up at all. Now let's talk about Diane. Diane is 67, a retired nurse, someone who spent 30 years reading other people's lab results and rarely thought to ask questions about her own. She'd been on metformin for close to 4 years, feeling generally fine when she started noticing something odd: tingling in her feet, occasional brain fog, a tiredness that didn't match her activity level. Diane, of all people, assumed it was just getting older. It took a routine blood panel, ordered almost as an afterthought, to reveal the actual pattern. Long-term metformin use is associated with reduced absorption of vitamin B12 in some people. This is well documented in the research and is one of the more commonly cited long-term considerations for anyone on this medication for several years or more. It doesn't happen to everyone, and it isn't dangerous when caught, but it's also not something most people are ever told to watch for. The symptoms Diane noticed, tingling in the extremities, brain fog, fatigue, overlap heavily with just getting older, which is exactly why this tends to go unrecognized for years. A simple periodic blood test is generally all it takes to catch it early. Here's something that surprises a lot of people: alcohol. Not in a dramatic sense. A single evening drink isn't typically the concern most people imagine. But combining metformin with heavier or more frequent alcohol use is one of those combinations that increases risk in a way that's rarely spelled out clearly. because it involves the same pathway connected to that rare but serious emergency we mentioned earlier. This is exactly the kind of ordinary, everyday habit meeting a medication in a way nobody thinks to mention, worth a conversation with your doctor, not a reason for alarm. Here's a specific, simple thing to bring to your next appointment. Ask whether it's time for a B12 level check, especially if you've been on Metformin for more than 2 or 3 years. It's a 5-minute conversation that can catch something early instead of years later. If you've made it this far and found this useful, type the word route in the comments, a small nod to Frank's 22 years on his mail route. It helps me know you're here. I want to take a moment on something important. A single unusual day, one bout of stomach upset, one tired afternoon, doesn't automatically mean something is wrong. Bodies have ordinary variation. What matters is the pattern over time, and whether new symptoms are persistent, worsening, or match the specific warning signs we've covered today. Reacting to every sensation with alarm isn't the answer, and neither is dismissing a real pattern because you don't want to bother your doctor. The middle path, noticing, tracking, and mentioning things at your next visit, or sooner if something feels seriously wrong, is what actually keeps you safe. Metformin is one of the most well-studied and widely used medications for blood sugar management, and for most people, it's safe and effective for years at a time. Understanding what's ordinary, what's worth a simple test, and what needs prompt attention is what turns a worried patient into a confident one. If this helped make sense of something you've been quietly wondering about, subscribe for more of these breakdowns, and I'll see you in the next one.